60 to 80% of the forces across the wrist is transmitted from the scaphoid and lunate bones at the distal radial ulnar joint. Remember, neutral ulnar variance and negative ulnar variance can change those forces. And if the person has a positive ulnar variance, there will be an increased load bearing through the ulnar axis. The triangular fibrocartilaginous complex includes the radial ulnar ligaments, an articular disc, the ulnocarpal ligaments, and the extensor carpi ulnaris sheath. When there is a triangular fibrocartilaginous complex injury, it can occur either traumatically or chronically. In a traumatic mechanism of injury, we will generally see an axial closed chain weight-bearing wrist rotation and a hyperextension with ulnar deviation. This motion results in compression of that articular disc. It may also occur due to extreme radial deviation or a distal radial fracture. We will see chronic TFCC injuries in people who participate in canoeing or kayaking, in racket sports, or in golf. There is a classification system for the abnormalities called the Palmer classification. Class 1 classifications are due to traumatic or acute causes. They are classified in 4 levels, A through D. A is a central perforation. B is an ulnar avulsion with or without distal ulnar fractures. C is a distal avulsion. And D is a radial avulsion with or without a sigmoid notch fracture. The Class 2 are degenerative stage injuries, specifically ulnocarpal abutment syndrome. Class A is TFCC wear. Class B is TFCC wear with lunate and or ulnar chondromalacia. C includes a TFCC perforation with lunate and or ulnar chondro and lunate triquetral ligament perforation. And D is the TFCC perforation with the lunate and or ulnar chondro, a lunotriquetral ligament perforation, and ulnocarpal arthritis. Signs and symptoms of this type of injury include edema within the disc space, localized pain and point tenderness, clicking that is associated with pronation and supination. The person will complain of being dysfunctional with pronation and wrist extension. They will be unable to bear weight, and an x-ray will show a positive ulnar deviance. And because of this positive ulnar deviance, there will be an increased load bearing through the ulnar axis. There are several special tests that can be performed. The TFC compression rotation test, which will put pressure on that disc. Shear tests or slide and glide tests can be performed at the radial ulnar joint and at the ulnocarpal joint. And then varus and valgus stress tests at the wrist joint can also be performed. An x-ray can assess the ulnar variance, and treatment may be conservative or surgery. Conservative treatment will be a short arm splint or cast immobilization, and surgery will consist of a debridement and a repair of that complex.